everyone, welcome back to my Silly Nursing YouTube channel. Thank you so much for tuning in. Today we are going to talk about common assessment commands that you will make in Spanish to your Spanish speaking patients. For those of you that don't know, I have Spanish medical terminology translation badges that you can put on your badge every single shift, every single clinical, and I sell them on my Etsy page. Search up Silly Nursing on Etsy, or you can click the description box below to have access to them. This is actually one of the badges on one side because I sell them in a package of 5 and there's actually 10 sides. So you're getting an absolute incredible value for amazing quality. These are very nice PVC cards and the designs are really cute. I designed them myself. So this is actually part of the package. It'll have the assessment commands in English and in Spanish for you to translate and have with you. So today we're going to cover these assessment commands. So there are different ways that you can tell a patient in Spanish that you're going to perform an assessment on them. The word by itself, assessment, you can say evaluación, you can say examinar. Now depending if your patient is a male or female or identifies as a male or female, things will change a little bit. If you're telling a male that you're going to perform an assessment on him, you're going to say lo voy a evaluar, evaluate, lo voy a examinar, examine. The same thing goes for someone who is female or identifies as a female, la voy a examinar, evaluar, right? So those are the only things that kind of change when you're speaking to someone in Spanish. Now let's go through some of the things that you can tell them whenever you're going to perform an assessment. So going from head to toe, these are certain things that you might have to say to a patient. One of them being, I'm going to shine a light in your eye, right? You're going to check their pupil dilation. You take your pen light and you're going to say, le voy a alumbrar los ojos. Le voy a alumbrar sus ojos. I'm going to shine a light in your eye. If you're going to check their eye movement with the 6 cardinal gazes, you can say, sigue mi dedo, follow my finger, sin mover la cabeza, without moving your head, right? When you want them to do this, sigue mi dedo, sin mover, without moving la cabeza, your head. Another thing that you may assess for when you're checking someone's head region is to open their mouth. So the way of saying that is abra la boca. Abra, open, la boca, the mouth. And same thing, if you want them to stick out their tongue, you say saque la lengua. Saque la lengua. Lengua for tongue. Now for those moments where you're going to assess their heart sounds, lung sounds, abdomen, bowel sounds, you're going to say voy a escuchar su, voy, I'm going to, escuchar, listen to, your is su. And at that point you can say corazón for heart, you can say pulmones for lungs, and for this you would change su for your to sus because it's plural. So voy a escuchar sus pulmones. You have 2 lungs. And for bowel sounds, you can say voy a escuchar su estómago, your stomach, sus intestinos, your intestines. If you're going to tell them, I'm going to press on your stomach, for example, let me know if you have pain. You can say voy a presionar su estómago. I'm going to press your stomach. Déjame saber, let me know, si siente dolor, if you feel pain. If you're going to inspect the stomach or inspect their back or anything like that, you can ask them, may I lift your gown? And the way you say this is, me permite alzar, right, lift. Me permite, am I permitted to, in other words, alzar su bata, lift your gown. To tell someone that you're going to check their pulses, all you have to say is voy a checar sus pulsos. Voy a checar. I'm going to check sus pulsos, your pulses. Additional commands that you can make, for example, if you want the patient to push against something to test their strength, empuje contra, push against, mi mano. Empuje contra mi mano, right? And you can put your hand on their knee, on their leg. Empuje contra mi mano. Push against my hand. To test their strength on their hands, you can put your fingers between their hands and you can say apriete mi mano, right? Apriete, squeeze, mi mano, my hand. To assess the range of motion, you can ask them to bend or extend whatever body part you're assessing, right? For example, for the word extend, you're gonna say extienda. Extienda su brazo. Extend your arm, right? For bend, you can say doble. Doble su brazo. Doble su pierna. Pierna is leg. And this is where my cards become handy with one another because we do have the assessment part and we also have the parts of the body. So here on the assessment card, you will see that it's extienda su, doble su, and on the parts of the body, you have them all listed here. Su brazo, su pierna, su rodilla, las muñecas. And when it comes to listening for, when you're assessing, voy a escuchar su. I have all of the organs on the other side of the body. So you can really use these cards together. The very last assessment portion I'm going to talk about is checking for edema. So you don't have to use fancy words. You can just tell your patient that you're checking for any signs of inflammation, water retention. The way you say this is voy a checar si tiene inflamación or hinchazón. Voy a checar, I'm going to check, si tiene, if you have, hinchazón o inflamación. Inflammation, edema, swelling. And that concludes this video. Thank you so much for watching. If you enjoyed this video and learned something today, hit like, drop a comment, hit subscribe so that you can watch more of my videos. Check out my Silly Nursing Spanish translation badges on my Etsy if you're interested in purchasing a package. In the future, I do want to make more focused assessment videos and incorporate some assessment questions that you can potentially ask, but also let me know what else you would like to see. Thank you so much for watching.